Hey everybody, I hope you all had a nice Thanksgiving. It's 5 and we're doing an IG Live at 5 because I wanted to get the lowdown on this new variant of that we've been hearing a lot about from South Africa, and I think government officials. Hi Jen, hi Josh, hi everyone. I hope you guys had a nice Thanksgiving. As I said, I thought it might be helpful for us to just have a conversation with my friend, Dr. Jeremy Faust. He is an emergency physician at Brigham and Women's Hospital and an instructor at Harvard Medical School. He has been all over the coronavirus. He writes a newsletter called Inside Medicine. And let me see if he's, hi everybody. Anyway, great to see you all. I don't know, I'm a little concerned. Oh, thank you. I'm glad you like my book, Lori. I'm a little concerned about this new strain of virus. It's called Omicron or Omicron. Omicron, probably, right, John? Omicron. And it has a very unusual constellation of mutations, with 50 mutations not seen in combination before, including more than 30 in the spike protein that the coronavirus uses to attach to cells. Okay, what does that mean, everyone? Let's see if I can find Jeremy. I hope he's requesting to come in. Where are you? Hey, Adriana or Julia, do you see Jeremy? Right now I don't see them. Request to join. He should be here momentarily. He told me his 3-year-old was up a lot last night, so he might be a little tired. You're not worried. I'm glad that people aren't worried. Anyway, let's view this request. Here he is. We're going to get the scoop from Jeremy, who's going to tell us kind of what's going on, when we're going to have more information about this particular strain. Hey, Jeremy, how you doing?
Hey, Katie. I'm doing well. How are you?
I'm good. Did you have a nice Thanksgiving?
I did. How about you?
I did. It was nice. It's really cold in the north. Well, it must be really cold in Boston, right?
A little dark, but it's all right.
Anyway, so listen, I thought it would be helpful for all of our friends here on Instagram to kind of learn a little bit more about this virus, because I started reading about it a few days ago, Jeremy, and I got pretty nervous, honestly, when they were talking about, I think I was with my family for Thanksgiving. There had been 22 deaths in South Africa from this particular strain. So tell us what we know about. It's called Omicron or Omicron? How do I pronounce it?
I always said it was Omicron.
Okay.
I hope that's right. I was never in a fraternity, but the Greek letters are somewhere in the back of my mind. I think it's Omicron. And this is a very interesting situation because when you think about the dizzying pace of scientific learning, we didn't even know this thing existed 5 days. November 24th was the first time that we even heard of this thing, this new string of mutations causing this new variant. And then 2 days later, on Friday, the WHO really jumped all over it and said, look, we're really worried enough about this that we're going to give it a name, which is kind of the way you think about it, almost like the way we think about meteorologists giving storms names. Like when they give a name to a storm, that's when it's reached a certain category. And that's what they said, okay, it sort of reaches for us. We're going to give it a name. And actually, I think we can talk about this. I think they actually named it kind of prematurely. They're that worried that even though it doesn't meet the definition for a variant of concern, I get why they're moving on this. So it's all moving quickly.
Well, let's talk about a couple of things. First of all, I was just before you joined talked about how this has a very unusual constellation of mutations. And I know the head of Moderna basically said it was kind of a very nerve-wracking thing to hear about this new strain of the coronavirus. So tell us about these mutations, what it means in terms of, will the current vaccine protect us against this particular strain of coronavirus, and what you've been able to learn, because I know since we talked this morning, you've been on the case doing all this research about it.
Yes, there is so much to do, and what you just asked, we could take 2 hours on. So I'm going to try to you said a lot, and I don't know if people realize how much you just said. Because let's start with mutations. Every single virus, every single living entity like us, we are a string of genetic code, and then that code gets turned into things like your hair or your eyelashes or your skin, everything. And so a mutation is just a change in that code. Now, what alarms us with Omicron is that it has so many new mutations all at once. And many of them are at the part of the virus that make us worried that it might have some characteristics, like it could be more contagious or it could break through our vaccines. But I will tell you that we are actually kind of far away from knowing that. Like, our modeling is really good, that we can say, oh, look, this change in the genetic material probably means this, but we really don't know until we collect clinical data. And so we look at these mutations, and you can have 100 mutations, you could have 1,000 mutations, and they could actually all synergize to a big nothing, that nothing changed really. Or you could have 2 mutations that are devastating. And so the sheer number of them, I think, is what got our attention, and where they're located. But I would actually tell you, I don't think that we really know anything more than that. We just know that, ooh, this doesn't look great, but let's dig more. And interestingly enough, with the vaccine question, you could look at it 2 ways. If this virus, if this new version of the virus is so very, very different than the one that you and I are now vaccinated against, it's possible that that virus is also not very good at entering our cells. That, in other words, if the same lock and key that our antibodies use, the virus may find it's harder to get into our cells. So there's no real way of knowing right now what these mutations mean, but I think in the next week or 2, we're going to find out.
Yeah, so I guess they're studying it. And in the meantime, let me just ask you, what about the vaccine? So we won't really know if this vaccine, the current vaccines or the various vaccines are going to be efficacious against this particular, I've got some really weird followers that I have to block. Anyway, this particular strain of the coronavirus, right, Jeremy?
Yes, that's going to be looked at in 2 specific ways. The first way we can learn very, very quickly, and I imagine in the coming days we're going to know this, and that is under the microscope in the laboratory with our biochemistry assays that just test things. How well do the antibodies that we all have, if we're vaccinated, how well do they bind and attack this new virus? We will know that in a matter of days. Now, that is just information on a piece of paper. We've seen correlations in the past, like, okay, when there's worse binding, that maybe spells less protection. But we don't always know that it's 1-to-1. You could have a 50% decrease, a 50% lower binding in the petri dish, so to speak, but still have 99% of the clinical effect, because our bodies are good enough at this game. So we'll learn that. And then the second piece will be clinical. We'll say, look, people who are vaccinated, people who've been exposed before, who are recovered, how are they doing when they are exposed to this virus? Do they get infected? Which I expect probably some will. But the real important question is, do they get really, really ill? Do they get severe illness? Are we kind of back to square one like we were before the vaccines? And I highly doubt that. Partially because I'm an optimist, but also partially because I actually think that the kind of immune memory that vaccines generate in us are pretty robust. And so our body is pretty smart. We don't just make a memory to the thing we saw. We start over time, we say, well, what if we actually saw some cousins of that sucker? Why don't we prepare for that too? So we do that, and we sort of prepare for that. It's a remarkable thing. We've been doing this for hundreds of millions of years. Our cells have been fighting these fights.
Well, so are pharmaceutical companies, though, are they trying to figure out, do they have any information where they can start fashioning a more effective vaccine in the event that this one isn't effective against this new strain? And I guess it's really way too early for that, isn't it? Or is it?
It's too early. I will tell you, I've been speaking to my colleagues on the ground in Southern Africa, mostly South Africa, and they're seeing an increase in cases, but so far they're not telling me, oh my God, Jeremy, all I'm seeing is breakthrough hospitalizations, breakthrough deaths. I'm not hearing that. I'm hearing the same thing we heard for other variants. That is, this variant makes the unvaccinated feel really terrible and it's dangerous. So that's the first thing I'm hearing. I'm not hearing that story per se. I think we'll know in the coming days. The answer to your question, how fast can Moderna, can Pfizer, can Johnson & Johnson act on this? And this is a moment where I think that our prior work is really going to pay off if we do hit the sort of doomsday scenario and then we're back to square one. I have been talking to people who are doing this, and people at the White House and the CDC and even in the FDA, and they feel that Pfizer and Moderna could churn out within 100 days, possibly, tens of millions of doses of a new vaccine if that were to become necessary. Now, I think that's probably on the optimistic end of things, but I don't think it's like crazy science fiction, like in some movie, like, oh wait, let's do something that's crazy. I think it's actually within the realm of possibility that we could develop a new and effective vaccine against this variant in just a few months. Now, that's a long time to wait, given what we've been through, but it's amazing considering where we started.
Obviously I'm pro-vaccine, but to continue getting all these different vaccinations for various strains of a virus is a little disconcerting, isn't it? Or is it not?
And I think that's a great question. And I think that's a really important distinction that we should be making is what are we trying to fight? If we're just trying to fight infection because you don't like the name of the virus, it's called coronavirus or SARS-CoV-2, but all it really does is knock you out like a cold, then I'm not sure that adding a protection on top of your existing vaccine really accomplishes very much. If we're back to square one and this virus is putting so many people in the hospital and disability and killing so many, then yeah, I think there's nothing that wouldn't be worth that. But at some point you kind of ask yourself, wait, why am I getting a fourth or fifth or sixth dose just so I don't miss a couple of days of school or work? And in a way, it's like PTSD. It's like, well, wait a sec, this thing used to be really fearsome. And now what? Well, yeah, I get that there's no infection is good, but at some point you're right. There becomes the needle kind of tips. And I think that we're not there yet for most populations, especially older populations, but we could get there.
Let's talk about travel, because I know there were conversations like all these different countries are trying to figure out, I don't know, has travel been stopped to South Africa and a number of countries in that region? And some people are saying that's a little draconian because they have very sophisticated detection systems and it's almost like they're being punished for that. I don't know. What are your thoughts on limiting or John, do you think they're saying you can't go to South Africa at all? You can't travel there?
Yes.
Yeah. But do you think that's prudent? Do you think it's too much? And what about travel in general? It says several cases have now been identified in Europe, 2 in the UK, 2 in Germany, 1 in Belgium, another 1 in Italy, while a suspected case was found in the Czech Republic. It says countries have banned travel from South Africa. This is being written as we talk. This is our Google document from which we're working. But give me your opinion on international travel in general. I know a number of my friends have said we're planning to travel internationally over the holidays. Please ask Jeremy if that's a bad idea.
Okay, yes. So let's start from the first question. The current United States travel restriction that was announced, I believe yesterday, feels like it was a week ago, but I think it was just yesterday. And they basically said that starting tomorrow, it's not even really in action yet, you cannot return from South Africa and 7 other nations in the Southern African region to the United States unless you're a US citizen or you're a US lawful permanent resident. But that makes no sense to me because it's not like if I were in South Africa and I had a passport, I couldn't be carrying Omicron back home with me. So I think that actually was a really, really poorly conceived idea. You either shut the door completely or you realize that you can't. One of the problems with people who might say, well, why don't you slow it down? Just do something and at least let the citizens get back. But the problem with that is, Katie, I actually think that it punishes transparency. And I think you were getting at that. The idea here is that if a country detects something new like this, it's probably going to be detected in a neighboring country in a day or 2 or a week. And so why would you want to tell anybody about it? Because you're going to get punished. And so what it does is it actually encourages people to not be transparent in future. And that would be terrible because if we do need to ever really shut down all travel, then we would want to know that. I think in this situation, I hate to say it, but I think Omicron's probably already likely here. I don't think we're going to keep it out. And I don't think that just basically punishing a couple nations that were transparent, and also this weird application of only non-citizens, as if that's any different. I just think it makes no sense. And so I have actually been very critical of this choice. I think that escalating concern is extremely important right now, but I feel like that they're trying to look like they're doing something, and I just don't think that does much.
What about international and travel? from other countries where there have been reported cases?
Again, I don't think it much matters because I truly think that the problem is it's sort of like, what's that movie? Like the calls coming from inside the house, like it's already here. I think that, for example, right in the beginning of this whole crisis, the travel ban from China, it might have slowed things down a little bit. And at that time, it made some sense to slow things down a little bit if you were going to use that time wisely, if you were going to use that time to build tests, if you're going to use that time to make a plan that really would save lives. I don't think we use that time wisely. So at this point, if we were to slow it down, to do what? And I guess the only answer would be to, if in the worst case scenario, the vaccine no longer works, and to give those companies a head start. But that's really the doomsday. So I actually kind of think it's like all or none. In terms of traveling to other places on the holidays, you know, in 2 weeks, we're going to know whether our vaccines are still good or not. Until that happens, I don't think I could give anyone a really informed answer on that. But let me just say this. If this thing is in the same ballpark as Delta and it behaves similarly as Delta, that's not a great virus. But if you have 2 doses for most people and 3 doses if you're at risk, you're protected against the worst parts of this disease. And you might choose to still make those calls. I personally, if it turns out to be another Delta, I will not cancel my international travel plans over the winter. If I think that my vaccine is not protecting me against hospitalizations, I will be canceling. But I think that we don't know that yet, so I'm going to wait and see.
When do you think we will have more information so people can start to make these decisions? Because the holidays aren't far away, and a lot of people have plans, some anyway, to travel outside the country. When do you think they're going to have the information they need to make an informed decision?
I'm hearing that we're going to know a lot more within a couple of weeks. Some of that will be completely anecdotal. And I'll be honest, if I go to work and I see a bunch of people getting hospitalized and I can see the dates of their 2-dose vaccine series, their 3-dose, their boosted series, let me tell you, that'll be enough for me. Granted, I don't want to be making calls on the ground based on anecdote, but if what I see matches what my other colleagues see, that'll be it. Within a week or 2, we should know that. In terms of actual biological or scientific research to support those choices, I think, again, it's going to take just a few more weeks, but I think we'll have a building story so that by the time we have actual patient data saying, look, here's what happens if you were vaccinated twice in the winter. Here's if you were boosted in the summer. This is what happens to your risk of infection, your risk of hospitalization. I think we'll know that in the next couple of weeks. And I think that given the stakes, I think we'll have a lot of answers, not all, but a lot of answers before the time that people have to go to the airport. I don't think they're going to be going to the airport with question marks. I think by then it'll be clear.
There was a pit in my stomach when I started reading about this, and I can only imagine people in the medical profession and frontline healthcare workers. Again, I don't want to be alarmist at all, and we have to wait until we get more information. But I mean, I'm just keeping every finger and toe crossed that this isn't going to be that serious, Jeremy, because I feel so for all these hospital workers who have had just such a exhausting wait. We have breaking news. 2 cases of new COVID-19 variant Omicron have been confirmed in the province of Ontario, government officials announced. Anyway, I think we're going to hear reports of this trickling in, but you were telling me earlier that a lot of doctors, nurses, and medical professionals are beyond burned out.
Yeah, and that's the main thing that I took away from talking to a couple of colleagues in South Africa today. They actually weren't necessarily concerned per se about Omicron. They were concerned about any new wave. They're just tired of this. And so if it was a Delta, if it was Alpha, if it was any kind of thing, again, they don't have enough vaccination there. Their vaccine is a combination of what we have and others, not as good in some cases. They're just exhausted of this, and I get it, and so am I. So I think that's the main thing, is whether this next wave is Delta, Omicron, or anything, it's another wave. And the same thing is true that the vaccine is the only chance to keep this kind of not from spiraling out of control. In terms of the fatigue factor, I think that, when I go to work, I sense none of that. I just go to work, and whenever you see COVID, which is still really unusual where I work these days because we have a lot of vaccination coverage. But when I see it, I just sort of, it's like you get that fire and say, okay, let's go do this. Let's take care of this patient. The exhausting part is the rest of the time when you're thinking about your life as a public health professional. When I think about my friends in areas that are harder hit, my friends who are doctors, nurses, PAs, everything. Yeah, people are burning out, and they're leaving the workforce, or they're taking a break, or quite frankly, they're taking plummier jobs, more money, but far away from the action. Sometimes they're going to the action, but taking money. So it's a bit of a cluster. And I think that all of us would love for this to be over.
Let me ask you some questions from social, because I want you to get back to your family. But here's some questions. Should I wait to get a booster, assuming the vaccine may need to be tweaked? I know the answer to that is absolutely not.
It depends on who you are. I'm actually
recommended boosters for pretty much everyone.
Yeah. But I'll be very forthcoming. My viewpoint on this is a little bit unusual, maybe at this point. I actually sided with a lot of the people at the FDA who thought that the booster was a little bit premature in some people. So I think that if you're over 50, you absolutely need a booster. I think if you're under 50 and you have any kind of like cancer, immune condition, you should get a booster. I think if you have a lot of these other conditions that count, that qualify you for booster, it's really up to you. You may find this surprising, Katie, but I am not boosted. I am not boosted. And part of me is gaming that. For example, my parents who are in their 70s, they got boosted pretty much early on. And I figure, look, they're really protected for the next few months. They're going to be the maximal protection, and I want to see them a lot and not worry about it. So I decided, well, let me just wait for some safety data, and I'll get boosted maybe in January or February, right when theirs wears off, and then I'll be able to see them and not worry so much. So there's always a different consideration. But if you were living with someone who had cancer, you should have been boosted yesterday, right? Already. So I think that if you're over 50, please get boosted, because Delta, Omicron, anything. There's too much breakthrough. For the rest of us, I think it's a reasonable choice. But actually, the talking point that I actually really want to make here is that the only good thing about these little panics, and sometimes they're just that, they end up being nothing burgers. And the only good thing is that some people who are on the fence about getting their first series get out and do it. And so people who are maybe not sure, or they put it off for various reasons, or they finally get there. And that to me is the most important piece. So dose 1, dose 2, and then dose 3 if you need it.
Okay. Well, hopefully those people are listening. Let me ask you another question from social. In addition to getting vaccinated, how do we protect our immune system from these new variants? Is there anything else we can do to be smart and I guess it's just sort of the usual advice, right? About eating well, getting enough sleep, exercising, those kinds of things.
Yeah, I think this virus is so contagious that all those things are probably fairly true. But if it's near you, you're going to get it if you're not protected adequately. I think that the actual thing that I have noticed, and I don't know, remember the first time we talked, you and I were talking, this is before we even understood how much airborne transmission there was. You and I were talking about how much we touch our faces and how the washing of the hands has become a better thing. I actually think that the pendulum swung in different directions. On one hand, my wife was wiping down fruit. And I was like, Kate, I don't think you need to do that. That's fine. On the other hand, I think I've now noticed that the sort of really vigorous hand washing that was going on in public restrooms or the hospital, I think that's kind of gotten a little bit weak, and we could return to that. So I think that for a little while, none of us had colds because we weren't
right.
We were better about our hygiene. So I actually would like to see that piece kind of come back again. Let's be really, really aggressive about that part. And, because actually, my daughter has a cold and we tested her for COVID. It's negative, but she'd have a cold for so long because there was nothing going around.
Right. By the way, a friend of ours just texted us that Israel is to close borders to all foreigners due to Omicron variant. So a lot of countries are taking action. I think Dr. Fauci said this morning, it's sort of better safe than sorry philosophy, but
can I tell you about this? I think Israel is extremely interesting to watch. And whenever these things happen, I always actually try to think of these in two lenses. One, what do the alarmists want me to know? What are the most worried people want me to know? And then I also think, well, what do the downplayers want me to know? And is there anything to that? And Israel is an interesting sort of bellwether because they also have a different set of problems. For example, their hospital capacity cannot be flexed like ours can. So their unvaccinated population gets Delta, gets Omicron, they're going to be overflowing and they're literally going to have people dying because of the overflow capacity issue. We may not face that. So they might be closing because of their unvaccinated population, not because of their vaccinated. So I just want to put that in perspective. And that's the reason why, by the way, they decided to be very aggressive with boosting young people. They announced very openly that boosting did not prevent hospitalizations as far as they could tell in young people. Because the first two vaccines are too good. But they knew that they should just take care of this for their population because it's tight, it's compact. So every situation is a bit different.
Got it. Someone asked, will we go into lockdown again? I think everyone, obviously it's premature to even address that question, but that's something that everyone is clearly concerned about. And of course, we're seeing in Europe all these cases increasing and going up, I guess, mostly among the unvaccinated.
Correct. And that's so far. And I think that the lockdown question is so important because, again, as you said, we're just tired and people can't do stuff. And I think that if you ask people to lock down at the wrong time, it's boy who cried wolf. You have to be so careful not to undercall or overcall, right? And if you overcall, then you regret it when you needed it later. If you undercall, people suffer. Can you imagine how difficult these decisions are? And I think that anyone who says that lockdowns are off the table is not paying attention. And I think that because if it's true, if this variant ends up being breakthrough in the worst way, and that you and I could end up in the hospital, or we could die even though we're vaccinated, then I would want to see a shutdown for while we got these new doses out. But what would be amazing is, unlike the first time, we would know with almost complete certainty that the light at the end of that tunnel is another vaccine that works. So for me, if someone tells me a goal, I'm willing to do it. What I think people have trouble with is sort of like protracted, no end in sight, kind of no off ramps. I think that's where people get really tired.
Not to be too skeptical, but what makes you so certain that a vaccine could be developed so quickly if in fact this has new mutations that affect the way sort of the virus operates?
Yeah, the reason I am optimistic about that is the technology that brought us all of these vaccines. They can be leveraged and harnessed very, very quickly. When you think back to how we got this first vaccine, we had the genetic sequence within a couple of weeks. We had the first trial dose in people's arms within a couple of months. Now, usually all the red tape about vaccines is getting people to enroll for a trial, because who's going to enroll for a trial for some disease they never heard of or a disease that's rare? Well, in this case, people lined up. And all the red tape and all the funding, it just all happened. So all of a sudden you saw what happens when there's willingness and funding. We got an amazing vaccine in less than a year. Now, from here on out, all you have to do is tweak it a little bit. So it's very easy with our genetic tricks to make a new version of it. And we would not be doing, as far as I understand this, I'm going to do a post on this tomorrow after I talk to some people at the FDA. We would not be doing clinical trials on these strains, on these new vaccines. We would be only checking to see, kind of like with the kids, does it elicit the right number of antibodies that we think correlates to a very high degree of protection? And so we should know that very, very quickly. So I actually think that it's a great example of how our technology is going to help us here.
Okay. Someone asked, oh, this is a good question, Jeremy. Do we know if our COVID tests detect this new Omicron strain?
That's a great question. And the answer, as far as I know, is yes, it does detect it. Our tests do detect it. And actually, this whole thing of variant of concern versus variant of interest, right? Those different things. There's actually 4 levels. There's monitoring, interest, concern, and high consequence. And high consequence, we actually have never had one of those. And one of the things that would trigger high consequence would be, oh, by the way, our tests don't work anymore. That would be a real, disaster, because now we're back to square one where we can't track anything. That would be another reason to shut down while you make new tests, right? Because otherwise, again, what's the point of shutting down? You have to have something you're doing it for. Because I'll be honest, I actually think the final number of people who will be infected with this virus at the end of the day is 7 billion. I think every single person is going to get this virus at some point in their lifetime. The question is, what's your army look like? Your internal army looks like at that moment. And so that's the difference.
Okay. And again, people are asking, should we change our plans for the upcoming holidays? Again, you think in a week or two, we're going to have much more information about this new new strain, and I guess people just have to keep paying attention to what the CDC is saying, what Dr. Fauci is saying, where the science is leading us.
Yeah, that's right. And I think that one thing that we've seen during this is that the travel companies and the industry has been pretty flexible. I've been really appreciative of that. So that, again, I've got plans to travel right after Christmas. I'm not changing them now, but if all of a sudden, Omicron-ageddon happens, if that's a term I just made up, if that occurs, I fully expect that like the companies are going to be refunding us and all that. And I think it'll be pretty clear. Look, there's going to be some people who read the news and they're panicked and they're fearful and they can't even stomach the idea of being near this virus. And there's others who are going to say, look, as long as I don't end up in the hospital, I don't mind if I'm exposed. I think we'll have a better sense of what everyone's protection means by the time the day the travel comes. But I could be wrong, but I anticipate that for myself.
What about people wearing masks? I mean, somebody asked on this feed if they should start wearing masks again. A lot of people after they got the vaccine and even the booster became a little less, I don't know, careful about mask wearing. Is this reason to kind of start doing that again?
It could be. I think that my friend Celine Gallagher, who was on the Biden task force during the transition, said something kind of profound to me the other day. Someone said, how will we know when the pandemic is really over? And she said, when nobody wears masks anymore. That's it. You can kind of tell. That's how people decide. But even so, like, I think that a lot of us will wear masks for a long time just because in a way, to be polite, like, I mean, there's just some places where it makes sense. I think the mask question is really, really interesting. I think masks work a little bit all the time, but not all the time a lot. I think they help on the margins. And I also think that we've learned, especially in the Delta area, and I assume in the Omicron, if that takes over, that not all masks are created equal. I think that the trial from Bangladesh, where they really looked at this carefully, showed that at least cloth masks are not nearly as good as the surgical masks.
Right.
And the KN95s and the N95s are probably the best. So when I actually think that we owe it to people to be honest about that and say, look, it's a new day. We didn't know masks were necessary at first. Then we didn't. Then maybe for a while it was any mask was good. Now we realized, the better your mask, the better you are. So the problem with the N95s, Katie, is you get tired of wearing them because I mean I come off a shift and my face looks like a pancake. And so again, you can't let perfect be the enemy of the good. So I would tell people, well, wear a mask or two that when you're out and about in a low density area. But for me, like when I go into like the supermarket and it's really busy, I'll throw my N95 on.
Yeah. Let's just review for people who might have joined us late. This Jeremy Faust, he is he's a board certified, ladies and gentlemen, emergency physician at Brigham and Women's Hospital, instructor at Harvard Medical School. He writes a newsletter called Inside Medicine. He's got, what else do you do? I mean, go ahead, tell us everything, Jeremy, so people will know you're a legit.
I'm legit because I'm with you, Katie. Well, yeah, I teach at Harvard Medical School, which is amazing because I see the brightest people in the world. They're just amazing, and I do see patients a couple times a week as well. And I sort of become an unpaid public health researcher, but it's really I'm borrowing grants from other people. So I work with a team here at Brigham and Women's in Harvard, and with a team at Yale University, and I've done some work with the CDC. And what I study specifically is this idea of excess mortality, which is the idea is not just how many COVID deaths are there, but how many overall deaths are there more. And that's especially important in places where you don't have enough testing. So if you're in some country where they don't have enough tests, but you can pretty much tell what the overall count is of people who've died. You can see how this pandemic is playing out. And just kind of a sneak preview, my team is actually doing a pretty nice comparison of that to 1918 in a way that hasn't been done before. So we expect to be able to share where this stacks up with 1918.
All right. So let's just do the headlines. Basically, this Omicron variant has been, it seems to have originated in South Africa. I don't know what the death toll is, but it seems to be highly contagious, more powerful, my understanding is, than the Delta variant. Is that not true?
Yeah, this is
Why do you explain?
Those are the right questions. So I think that right now we know this, it has 30 mutations or more, which is an incredibly high number of mutations from one place. And I can explain that in a minute, but that worries us a lot, the number of mutations. But we don't know for sure whether it's more contagious. We just know that it's taking over certain regions. That could be because it's outcompeting Delta, in which case it's really contagious. Or it could be what we call a founder effect, which is that it kind of showed up in a place that was quiet and took over that place, as opposed to competition. We don't know that. We'll know that very, very soon. Piece of good news on that headline is that right now in those areas, Omicron is dominant, okay? But the absolute case numbers aren't that high. So that tells me maybe it's just outcompeting nothing as opposed to Delta, but we will see. Second piece, is it more, does it cause worse disease? Does it cause worse disease? If anything, I've heard the opposite. It's totally anecdotal, but a lot of patients we hear from Africa, we've heard that they come in with mild disease, and that's what triggered them to notice it. They noticed that some people were having different symptoms, but not necessarily catastrophically worse. And so they looked into that, and I give them so much credit for kind of being on it.
Different symptoms?
You know, I can't remember what I read, what the doctors who were talking about said, but they were just noticing a different kind of sequence of symptoms.
Wait, Jeremy, can I ask a dumb question? Are the cases among unvaccinated people or vaccinated people that are starting to surface in South Africa and in other countries?
Specific numbers are not available to answer that question. But again, what I'm hearing from people who are there and who've seen this is that it's just like always, it's mostly the unvaccinated. I actually have not heard a single person say to me, hey, Jeremy, I just had a patient come through who was double, triple vaccinated, and they've got Omicron, and they're in my intensive care. I have yet to hear that. Now, that doesn't mean it's not going to happen. We need the next week or two to see that. But if that was what I was hearing, I would be in a very different level of concern than I am now. I'm concerned, but I'm nowhere near like that.
Any other closing thoughts before we go? Because we've been doing this for almost 40 minutes and you've been so generous, but any other things that you think people should know? Because I do think people are probably reading all these articles and thinking, oh my God, are you kidding me?
The thing I want people to know is that science has brought us to a moment where we are so ahead of this for once. Like, we are actually responding to something completely based on laboratory data, like sequence information and epidemiology in certain cases showing up in certain places. This is not like before, where it took a bunch of patients showing up dead in intensive care units for us to figure it out. We got there early. And so that could mean that this can go one of two directions. Either all the fears come true, in which case we're going to have to adopt, and I really am confident that we would be able to. Or two, you know what? We'll have to admit that we can stand down and be vigilant and keep doing the things that we know matter. So I think we're at a very interesting place right now where we know enough to be worried, but not so much that we know exactly where we're at. And that's frustrating for people, but I actually think it's a little bit reassuring. It beats the alternative.
So basically, stay tuned, keep following this, and hopefully science will catch up with the phenomenon that is occurring not only in South Africa, but in cases in other parts of the world. We just heard about Ontario and in Europe, as we mentioned, some of the other places, 2 in the UK, 2 in Germany, 1 in Belgium, another 1 in Italy, suspected case found in the Czech Republic. And these are only reported cases. So who knows if these numbers are even legit. But Jeremy, Faust, thank you for doing this. People love to hear you talk about this on Instagram, and really appreciate your guidance on this. I for one, am really happy because you've allayed a lot of my concerns, and you know, you have my number, so text me when you have something interesting that I can share with people on social media.
Thank you. You know, I try to tell people where we're at, and I don't want to alarm them, but I don't want to falsely reassure them. And that's sort of the theme that I keep coming back to, is what can I give people that actually helps them? And I think that people sense that, you know, we have to be humble when we know and what we don't know. I'm so happy we've learned so much in such a short amount of time, but the next week is going to be extremely interesting. So I will update you as soon as I know anything.
Okay. Thanks again, Jeremy. Really appreciate it.
Happy holidays.
Bye.